Hello, everyone. Today we're going to be talking about stroke. Our discussion is going to be divided into three parts. One, the cause and effects. Two, prevention. And three, we're going to be sharing some scriptures of healing. Cause and effects. What is stroke? A stroke is a life-threatening condition in which the brain does not have enough blood flow. As a result, parts of the brain cells start to die because of lack of oxygen. There are two types of strokes, ischemic and hemorrhagic. Ischemic. This is where a blocked artery cuts off blood to an area of the brain. 85% of stroke patients have this type of stroke. And hemorrhagic, this is where a blood vessel leaks or bursts and blood spills into the brain tissue or surrounding brain. Ischemic strokes usually happen when there is a formation of a clot in the brain called thrombosis. A fragment of clot that formed elsewhere in the body breaks free and travels through the blood vessels until it gets stuck in the brain. This is called embolism. When there's a small vessel blockage called a lacunar stroke, this can happen when you have long-term untreated high blood pressure or hypertension, high cholesterol or hyperlipidemia, or high blood sugar, type 2 diabetes. Another cause is unknown reasons. This is called cryptogenic stroke. Ischemic strokes usually happen because of blood clots due to, but not limited to, the hardening of arteries and consequently limiting of blood flow caused by the gradual building up of plaque, that is, fat, cholesterol, and other substances inside them. Clotting disorders, that is, a condition in which the body makes blood clots more likely than normal. Due to atrial fibrillation or AFib, especially when it happens due to sleep apnea. AFib is an irregular heart rhythm that begins in your heart's upper chambers or atria. Due to heart defects such as atrial septal defect, ASD, this is a heart defect that involves a hole in the muscular wall that separates the two upper chambers of the heart, or ventricular septal defect. This is a heart defect that involves a hole in the wall that separates the two lower chambers of the heart, as well as microvascular ischemic disease. This is a term that refers to a variety of changes in the small blood vessels of the brain and results in narrowing of small blood vessels from wall thickening and plaque buildup. Hemorrhagic strokes. Hemorrhagic strokes usually happen when bleeding inside the brain, that's called intracerebral. This happens when a blood vessel inside the brain tears or breaks open, causing bleeding that puts pressure on the surrounding brain tissue. Bleeding into the space between the brain and its outer covering, that's called the subarachnoid space. This happens when a blood vessel that passes through the arachnoid membrane, that's a thin layer of the tissue that surrounds the brain, gets damaged and results in bleeding in the subarachnoid space, putting pressure on the brain tissue beneath. Hemorrhagic strokes can occur due to, but not limited to, the following reasons. High blood pressure, especially when you have it for a long time, when it is high, or both. High blood pressure contributes to 90% of all strokes. The higher the pressure, the greater the risk. Brain aneurysms. This is a bulge in a weak area of a blood vessel in or around the brain. Brain tumors, including cancer. This is an abnormal growth or mass of cells in or around the brain which can impact brain function if they grow large enough to press on surrounding tissues. Diseases that weaken or cause unusual changes in blood vessels in the brain, such as Moya-Moya disease. This is a rare condition that affects the blood vessels in the brain, which can lead to brain bleeds and stroke in affected areas of the brain. Who is at risk of having a stroke? Anyone, whether children or adults. However, some persons are at a higher risk than others. Such persons include people who are 55 and older, of Black ethnicity, men, family history, those who have a family history of strokes and heart attacks. If you're overweight, if you're physically inactive, if you drink alcohol, use drugs, smoke, have high blood pressure or high cholesterol, have poorly controlled diabetes, suffer from obstructive sleep apnea, and have certain forms of heart disease. Now, symptoms of a stroke. This includes loss of coordination or clumsiness, sudden loss, either or in part or total, of one or more senses, vision, hearing, smell, taste, touch, blurred or double vision, loss of muscle control on one side of the face, one-sided weakness or paralysis, slurred or garbled speaking, difficulty with or loss of speaking ability, dizziness or vertigo, nausea and vomiting, neck stiffness, emotional instability and personal changes, confusion and agitation, seizures, memory loss, headaches, passing out or fainting, and coma. These are all symptoms of a stroke. Prevention. How to prevent stroke. 1. You need to manage your blood pressure, manage your blood sugar, improve blood cholesterol. Do not smoke. Avoid alcoholic beverages. Maintain a healthy weight. Exercise regularly. Sleep. Get treatment for AFib and eat a healthy diet. How can I manage my blood pressure? Normal blood pressure is defined as 120 over 80 millimeters of mercury. Blood pressures even slightly above that have an increased risk of stroke. However, for some persons, a reading of 140 over 90 may be more appropriate and recommended by a doctor. You may be able to better manage your blood pressure by maintaining a moderate weight, getting regular exercise, at least 30 minutes per day, eating a heart-healthy diet and avoiding high cholesterol foods, reducing salt, sodium to be specific, intake, no more than half teaspoon per day. Some people may need medication to help lower blood pressure and reduce stress on blood vessels. Manage blood sugar. Diabetes is a significant risk for stroke. Stroke accounts for 20% of deaths in people with diabetes. People with prediabetes have a higher stroke risk as well. You may be able to better manage your blood sugar by maintaining a moderate weight, getting regular exercise, again, at least 30 minutes per day, eating a healthy diet, reducing salt, sodium intake, again, no more than half teaspoon per day. Some people may need medication to help keep blood sugar within a healthy range. Improve blood cholesterol. Improving blood cholesterol isn't just about lowering bad cholesterol, LDL. It is also about boosting good cholesterol, HDL, as well. People with high LDL may have a greater risk of ischemic stroke, but persons with low HDL may have a higher risk of hemorrhagic stroke. A healthy diet of good fats and proteins may help balance these numbers. These include olive oil, avocados, nuts. Some people may need medication to reduce cholesterol and lower risk of plaque buildup in the arteries. Do not smoke. People who smoke have a 2 to 4 times greater risk of ischemic stroke than people who don't. The good news is, within 2 to 4 years of quitting, your smoke-related risk of stroke will have reached 0. Avoid alcoholic beverages. Do not drink. Drinking alcoholic beverages can increase your blood pressure and, as a result, increase your risk of stroke. If you drink, stop. If you don't drink, don't start. Seek help if you need to. Maintain a healthy weight. Overweight and obesity are leading risk factors for stroke. They're also linked to other conditions or diseases that increase your risk for stroke, such as diabetes and high blood pressure. The risk of stroke in someone who is overweight is 22% times more than a person at moderate weight. For persons with obesity, the risk is 64%. Weight management techniques can include getting regular exercise and consuming fewer calories. However, for some people, those changes may not be enough to lower the risk. They will need to speak to a doctor. Exercise regularly. Exercise helps to lower blood pressure, lower blood sugar levels, lose weight or maintain moderate weight, support heart health, and reduce risk of stroke. People who exercise have a lower risk of stroke, and those who do have a stroke are less likely to die than those who are inactive. A moderate intensity exercise routine most days of the week is advised, even if you're not trying to lose weight. Examples include walking, swimming, gardening, hiking, etc. Sleep. Poor sleep is known to cause issues like fatigue, poor memory, anxiety, and depression, and may increase your risk of stroke. Sleep issues linked to stroke include insomnia, excessive daytime sleepiness, sleep apnea, hypersomnia, that is, sleeping more than 9 hours a day. Finding a healthy balance of 7 to 8 hours of sleep is recommended. Having a stroke can also worsen existing sleep issues, which can increase your risk for a recurrent stroke. Get treatment for AFib. Atrial fibrillation, AFib, is a type of heart arrhythmia or irregular heartbeat. It causes a higher risk of stroke and blood clots. It is linked to 1.9% of strokes per year. If coupled with other risk factors, the likelihood of a stroke increases. It must be properly diagnosed and treated by a doctor. For many people, treatment includes medications that prevent blood clotting. Eat a healthy diet. Eating a nutritious and balanced diet can help you lose weight and positively impact other issues that can contribute to stroke risk. For example, reducing sodium consumption may help lower blood pressure. Eating more healthy fats, like heart-healthy oils, may improve your cholesterol levels. Limiting added sugar and refined carbs can make managing blood sugar levels easier. Instead of focusing on calories, focus on eating more nutritious foods like fresh fruits, vegetables, legumes, whole grains, etc. Avoid or limit certain foods like refined sugars, red meat, and processed food. Foods that help to prevent strokes. Dried apricots, avocados, Swiss chard, potatoes, cashews, pumpkin seeds, sun-dried tomatoes, guava, watermelon, pink grapefruit, flax seeds, and walnuts. Scriptures of healing. Exodus 15, verse 26, and said, If thou wilt diligently hearken to the voice of the Lord thy God, and wilt do that which is right in his sight, and wilt give ear to his commandments, and keep all his statutes, I will put none of these diseases upon thee, which I have brought upon the Egyptians, for I am the Lord that healeth thee. Psalm 103, verses 2 to 3. Bless the Lord, O my soul. and forget not all his benefits, who forgiveth all thine iniquities, who healeth all thy diseases. Psalm 107, verses 19 to 20. Then they cry unto the Lord in their trouble, and he saveth them out of their distresses. He sent his word and healed them, and delivered them from their destructions. Proverbs 4, verses 20 to 22. My son, attend to my words. Incline thine ear unto my sayings. Let them not depart from thine eyes. Keep them in the midst of thine heart. For they are life unto those that find them, and health to all their flesh. Jeremiah 30, verse 17. For I will restore health unto thee, and I will heal thee of thy wounds, saith the Lord. Because they call thee an outcast, saying, This is Zion, whom no man seeketh after. The references for this presentation are mayoclinic.org, clevelandclinic.org, health.harvard.edu, healthline.com, cdc.gov, and eatthis.com. Thank you for listening.